Dave Robertson.
Thank you, Madam Deputy Speaker. And can I congratulate the previous speaker for his excellent maiden speech. I am sure he will be a fierce advocate for the people of Newton Abbot and the surrounding area over the coming years, and I look forward to working with him for the next few years. I'm very glad to be able to speak in this debate because it is a very important debate on primary care. It is an issue that affects all of our constituencies, but was absolutely the number one issue that came up on the doorstep during the election campaign across Lichfield, Burntwood and the villages in my constituency. And we are effectively here to discuss the centralism and poor decision-making that typify the last decade and a half of incompetence by the party opposite on primary care. Yeah. There can be fewer more obvious examples of this than the fate of Burntwood Health and Wellbeing Centre in my constituency. The building was home to a GP surgery serving almost 5,000 residents of the town, and the contract for this surgery expired in March last year. There was no replacement facility ready for that date, and so the surgery couldn't move, which meant it had to close. The building itself is still in use by the ICB, and the practice was happy to seek an extension, but it was not allowed by NHS England. The result of this is that more than 1 in 8 of the people of the town have had to be redistributed to other surgeries because a process in London didn't allow organisations in Staffordshire to deliver the best solution for my constituents. It's centralist, it's wrong, it was wrong then, it's wrong now, and it does need to change. Even worse still is that the proposed replacement facility, originally scheduled for completion in October last year, is still nowhere near ready. We're expecting planning permission sometime early in 2025, and who knows when it will actually be completed. This is such an important issue for my constituents in Burntwood, Madam Deputy Speaker, as we all know the potential knock-on effects that delays in accessing primary care can cause. The staff at the remaining surgeries are doing all they can to support the community, but at some point, increased patient rolls like this cannot be mitigated. It's one example of the challenges that people face in seeing a GP. It's not the only one in my constituency and very far from the only one across the whole country. It cannot be fixed overnight. 14 years of it going wrong will take longer than 14 weeks to fix. I applaud the Health Secretary, though, for going so far as he has so quickly, cutting red tape to allow 1,000 new GPs to be taken up, commissioning the Darzi review into the NHS so that this party, the one which created the NHS, can ensure that we build a health service which is fit for the 21st century.